I think that this morning we saw something that really interesting for the patient, because usually when we talk nowadays, we are starting to talk about the de-escalation treatment. And this morning, Professor Lambertini reported the first interim analysis of the Europa trial for the de-escalation of the adjuvant treatment in elderly patients, so patients more than 70 years old, yet are luminal-like patient, early breast cancer, stage 1, could be administered only with adjuvant radiation therapy or only adjuvant endocrine treatment. This is something that we need to address, because we know that the adherence to the endocrine treatment is not so simple, because every day we saw patients that have side effect for the aromatase inhibitor that we usually use for the postmenopausal patient. And you reported a really improvement in the quality of life of the patient that underwent only the radiation therapy. So a short period of treatment without great side effect, and improve really their quality of life. We still need longer follow-up to assess also the efficacy of omitting the endocrine treatment in this type of patient. But of course, the first data are really reassuring. And similar to this topic, also in this general session, performed also the analysis of the omitting the axillary dissection in the patient with stage 1 and stage 2. Of course, the insematria enrolled all the patient up to 5 centimeters, but we saw that the patient with T2 tumor were only about 10%. So for the patient with T1, stage 1 disease, we could avoid the axillary dissection. That could be a really problem impacting the quality of life for the lymphedema and on the long-term sequelae that could decrease the quality of life of the patient. And this study really reassured us to not perform the axillary dissection when the patient didn't have not suspect, not positivity to the imaging, so the ultrasound usually is the standard of care to assess that. And even if the patient had a positive sentinel lymph node biopsy, we could avoid the dissection with a superimposable outcome of the patient. So this is something that we could easily implement in our clinical practice to avoid the sequelae in our patients.